Efficacy of a device to narrow the coronary sinus in refractory angina. Definition: a growing number of patients with severe and diffuse obstructive coronary artery disease who are not candidates for revascularization have debilitating angina despite medical therapy. An endoluminal balloon expandable stainless steel hourglass-shaped device designed for percutaneous implantation in the coronary sinus creates a focal narrowing that leads to increased pressure in the coronary sinus, which may relieve angina. Application in medicine. We evaluate a coronary sinus reducing device as a new therapy for patients with refractory angina. Implantation of the device was significantly better than sham intervention in improving angina symptoms in patients with advanced coronary artery disease who were not candidates for revascularization and whose disease was refractory to standard medical therapy.
It is gently and easily deployed over the thrombotic lesion by retracting a protective sheath, and because of its inherent design and properties, it exhibits no recoil. As spasm is relieved, the vessel diameter increases, and the stent follows in expansion and continues its scaffolding of the artery. Finally, as the thrombus dissolves, the stent expands further to absorb the gap left by the dissolving thrombus, thus maintaining a perfect apposition throughout the remodeling process of the vessel. This allows the free mesh to cover the side branch ostium. The wide opening provides uncompromised access to the side branch for optional further treatment. The shape memory properties of nitinol make the disconnected ends return to their initial position and safely appose to the vessel wall.
The issue applied in Ecuador. The prevalence of refractory angina continues to increase, owing to its association with aging of population in Western industrialized countries and to increase the life expectancy of patients with ischemic heart disease. Therapeutic options that focus on angina relief and improve quality of life are needed for this group of patients. The pros and the cons. A placebo intervention alone can lead to a substantial improvement in angina symptoms and exercise duration. In a study of transmyocardial laser revascularization for the treatment of angina, a pronounced placebo effect was noted with a 30% improvement in exercise duration and angina symptoms in the control group of patients. Conclusion. In this small clinical trial, implantation of the coronary sinus with using the device was associated with significant improvement in symptoms and quality of life in patients with refractory angina who were not candidates for revascularization.